Hi, my name is Nicole. I'm going to be doing your assessment for CoolSculpting today.
Great.
Preparing for treatment day, we go back into the room. We're going to map out the abdominal wall, and then we're also going to map out where those peaks are, and that's where we want the center of our handpiece to be, because that's where most of that treatment's going to focus on. And then we get the client ready in the bed. First, we'd use a pre-treatment wipe. It's a 1-minute cold wipe, and that's going to be a protective barrier for the skin because we are using a cooling effect. We don't want to cause any tissue damage to the skin. And then after that, we place this gel pad on the skin as well. It's a little slimy, also a little cold, and that again is just a secondary protective measure for the skin. We want to make sure we're only targeting those fat cells. We take the handpiece. It's going to use a suction vacuum-like technique and pull all that tissue into the cup. It does feel a little funny. It's not something we're used to, but it's kind of like cool water rushing over the area. So after that, once it's suctioned on, we make sure it's secured properly to the client, and then we turn on the cooling effect. Once that happens, you'll start noticing that it's cold. It gets to a point where it's so cold that it almost feels hot. And then after about 5 minutes, you're numb, and then you'll be sitting there for a total of 35 minutes attached to that handpiece. After the 35 minutes, we'll come in, we'll take off that handpiece, and it'll feel really cold, it'll look red, it's kind of frosty looking, and we'll go in there and we actually do a deep tissue massage for 2 minutes, and that's really just to bring blood flow back to the area, and that's what starts the lymphatic drainage, which will get rid of those fat cells. So that's really important that we do that. After treatment, we're gonna get you scheduled in 6 weeks. We're gonna reassess at that point to make sure we're seeing where those fat cells have reduced, and if we need to update our treatment plan a little bit and retreat that second time to get you optimal results. We want to make sure that you feel comfortable in your clothing, you feel comfortable in your body, that we're targeting those stubborn areas of fat.